Evaluation for biological therapies for schizophrenia. Support for the effectiveness for antipsychotics comes from studies that have compared relapse rates for antipsychotics and placebos. In 2012, psychologist Lloyd carried out a meta-analysis of 65 studies which took place between 1959 and 2011, involving 6,000 patients. Some patients were taken off their antipsychotics and given a placebo. Within 12 months, 64% of the patients who had been given the placebo relapsed compared to only 27% of those who stayed on the antipsychotics drug. This suggests that antipsychotics are more effective at treating symptoms than placebos. However, the side effects that the drugs produce may be an issue. Typical antipsychotics can sometimes produce movement problems for the patient called extrapyramidal side effects. More than half of patients on the drug experience Parkinsonian-related side effects. If taken for an extended period, tardive dyskinesia can occur. This is because the drugs impact the extrapyramidal area of the brain which helps control motor activity. These side effects can be so distressing for the patient that other drugs have to be given to control them, or the patient may stop taking their antipsychotic medication completely. Meanwhile, with atypical antipsychotics, patients experience fewer extrapyramidal side effects. Therefore, patients are more likely to continue with their medication, which in turn means they are more likely to see a reduction in their symptoms. This supports the use of the newer atypical antipsychotics. However, this does not mean that atypical antipsychotics do not have side effects at all. A study by Crossley found no significant differences between the two drug types in terms of their ability to treat symptoms, but found the side effects were different. Patients on the older, atypical antipsychotics experienced more extrapyramidal side effects. Patients on typical experienced weight gain. A patient may switch if they do not like the side effects. This suggests the drugs are actually no different in terms of their ability to treat symptoms, just their side effects. Others suggest that medication is not the right way to treat schizophrenia at all. Ross and Reed, 2004, argue that using medication reinforces the patient's view that there is something wrong with them. The drugs only treat the symptoms, which means the individual may not think about possible stressors, for example life history, current circumstances, that might be causes for their condition. This reduces their motivation to look for solutions to alleviate these stressors. An international study found members of the public, when asked what caused schizophrenia, were more likely to cite social factors, such as a traumatic childhood or poverty, than they were to cite biological factors. This suggests that medication may be distracting from environmental factors which could be the real reason for why the condition has developed. Exam tip. In most cases the original, typical antipsychotics have more side effects. So, if the exam paper asks for 2 biological therapies, you can write about typical antipsychotics and emphasize the side effects. Then you can write about the atypical antipsychotics and give them credit for having less side effects.